Hi everybody, welcome to our first video together. So we wanted to do a video on the guidelines for non-specific low back pain, in particular non-radicular low back pain, so meaning that it doesn't radiate down your arms or your legs. Unfortunately, 80% of Americans at some point will deal with low back pain, and it's really important to understand what the guidelines are to make sure that you're getting the best care when and if it does happen. Statistically speaking, it more than likely will at some point. So I'm going to hand it over to Nick, and he's going to talk about those guidelines.
So, if you look up the American College of Physicians issues for guidelines on treating non-radicular low back pain, so that means the pain is not going into your hands or going into your feet. It's staying more local in the area, so say your low back or maybe just going into your glute. This is what they said, and this is in the Annals of Internal Medicine. So, physicians and patients should treat acute or subacute low back pain with non-drug therapies such as superficial heat, massage, acupuncture, or spinal manipulation. They didn't add exercise in there, and I don't know why, and we definitely do believe physical therapists and exercise are really important for low back pain. We absolutely believe that. If drug therapy is desired, physicians and patients should select non-steroidal anti-inflammatory drugs, aka NSAIDs, or skeletal muscle relaxants. So the big problem that we're having was, and it was a huge study that came out in 2019, I talked about this before. They looked at 20 years of people that were going to primary care MDs for non-specific low back pain, because most low back pain is non-specific. What do I mean by non-specific? There's no anatomical or tissue damage that they can see in imaging or that they can find or do orthopedic examinations and so forth. It's just non-specific. So, how do you go about treating that? And there's a lot of different things that can be used, whether it's chiropractic care, spinal manipulation, physical therapy, exercise stabilization, massage, acupuncture, yoga, stretching, so on and so forth. Different things work for different people. We're all different in that regard. But the one thing we know for sure is opioids being prescribed, because in this study over 20 years, 30% still were getting opioids, which is ridiculous, excuse me. It doesn't follow any of the guidelines whatsoever. It's also potentially very dangerous, especially when you look at the addiction problem that society faces and so on and so forth. The opioid-related deaths are skyrocketing for multiple different reasons, but it's a problem that's being addressed, but not being addressed at scale that how many people are dying or being addicted to drugs. So that's the main thing we wanted to talk about today. Was there are a lot of different types of care for non-specific low back pain, and we're not against medicine. Now, obviously, as chiropractors, we can't prescribe or give recommendations, but we get a couple toxicology classes because we treat patients that are, we're co-managing patients with medical doctors and so forth that are prescribing the medications. So we have to understand what these medications do and so forth in order to be able to see what's going on. So, but the other talk about problem is that we don't really discuss is, we live in a society which we both understand that getting yourself into a routine of exercising or doing these things takes more effort than just taking a pill. And this is why education is important, because we have to look long term and not short term in most cases. So that's the one thing we wanted to talk about. And one last thing, as I said in my last video, 4 to 6 weeks of conservative care is always the recommended guidelines for getting an MRI. And we also have to look at, and even if you are seeing signs of radicular symptoms getting worse, going towards your fingers, and maybe you have a disc herniation, and we take that imaging, that doesn't necessarily mean you need a decompression surgery or a fusion or something on that matter. So sometimes people are too quick to jump to surgical intervention when they haven't even tried conservative care whatsoever. And this is something that's, we take this approach backwards, where people will get the surgery, they'll get the fusions, and then they come and see us. And then we say, well, you got these rods in you. You know what I mean? There's only so much we can do. So, and it causes problems. But that's the main thing I wanted to talk about today. Is there anything you want to summarize that with?
Yeah, a couple things. One, when and if you get an imaging done, if conservative care is failing, that doesn't as he said, it doesn't necessarily mean that you need surgery, but it might also inform your conservative care provider, whether it's us or a physical therapist or a massage therapist, whatever. It can inform them how to change their treatment as well, so that they can be more effective with the conservative care. So to sum up, make sure that you're going to conservative care first, provided that there are no red flags. So things like night sweats and nocturnal pain, so pain at night, or not being able to make it to the bathroom on time.
Yeah,
that would be a red
reflexes.
flag as well. So if something like that is going on, then maybe seek out more emergency care. But otherwise, conservative care, definitely try that out first. Even get a second opinion if somebody recommends surgery or injections or something like that to you. Just remember that once they do the surgery, once they cut, they can't undo that. So just keep that in mind. Try to find a good chiropractor, a good physical therapist, whatever it is that you want to do. Try to find a good one for that. But other than that, that's all we got for today, guys.
Thanks, guys. Have a good day.